Hello, welcome back to Countmate Electrohomeopathy Forum, West Bengal. This is the fourth episode of our videos about electrohomeopathy. Our today's topic is Angioitico series of medicine. As we know that Angioitico series of remedies, they influence the blood and its motor nerve apparatus, that is cardiac and vascular system. So any destruction or derangement in the circulatory fluids bring derangement in the homeostasis condition of the body, organ and system, and this group of medicines play a vital role to bring the body in equilibrium. So the medicines are generally applied for the disease or destructions of blood series. In this series there are mainly three medicines, that is Angioitico-1, Angioitico-2 and Angioitico-3. Today we will go through Angioitico-1, the first medicines of Angioitico's group. First, let's know the composition of Angioitico-1. So Angioitico-1, the medicines that is composed of the specific essence of Arnica montana, Avena sativa, Capsula bursa pastoris, Hydaspes canadensis, Malva sylvestris and Sagnaria canadensis in different ratios. So this Angioitico group is a very broad group of medicines, and these medicines Angioitico-1 work from the scalp or head of the body to the toes. The basic influence or their therapeutic indications is very necessary to describe elaborately. So here we will try to elaborate these medicines and their effect on each and every organ. So first let's know what is the effect of Angioitico-1 on our brain and mind. The unconscious, indifference, and the people having inability to perform continuous active work, delirious, inability to keep mind on one subject, then after mental strain or shock, fear of space, nervousness, confused mind with sharp pinching pain in head, and the people depressed and cannot bear pain, a whole body that is very much sensitive one. In all these conditions Angioitico-1 works very nicely along with favourably. But mind it, Angioitico and favourably should not be mixed together but to be given separately as per the conditions of the patient. Other than this, the people having hot with cold dry scalp that is contracted and much compressed of forehead, in that condition Angioitico-1 must be used with favourably. The people having chronic vertigo then object which whirls about, especially when walking, sharp pain over the eyes, nervous headache, migraine, occipital headache, dull pressing frontal pain, especially if connected with constipation. This Angioitico-1 must be given along with scrofulous laxativa. In case of sinusitis and coryza, if the patient suffer from severe pain of sinusitis after coryza, in that condition Angioitico-1 should be given with this your petrol 4 on a P4. In cases of sunstroke also, periodic sickness, headache, pain begins in occipital, spread upward and settled over the eyes. In that condition also Angioitico should be given. Angioitico is also applicable pain over the parietal bone, myalgia, pain in scalp, muscles of the neck, generally spondylitis, veins and temples when distended. In that condition Angioitico-1 should be given. The next thing which we gave, the patient having complaint of burning in eyes, sometimes you get eczema on forehead along the line of hair, scalp eruptions behind the ear, and sometimes we get lips and the mouth cracked. In that condition too, this Angioitico-1 must be given along with cancerous of 15. Here Angioitico-1 will be the main medicines. Sometime patient suffer from follicular pharyngitis. In follicular pharyngitis, along with Angioitico-1, if we prescribe cancerous of 13, that will work in better way. The complaint having hacking of yellow, tenacious mucus, in that condition petrol 4 also works nicely along with Angioitico-1. Goiter, in cases of goiter Angioitico-1 is also applicable, but must be given it beside cancerous of 3. If throat swollen, dry and constricted, in that condition this Angioitico-1 also works nicely, but if petrol 2 along with Angioitico-1 will be given, then we will get result rapidly. In cases of tonsillitis also, ulcerations of mouth and faces, in that condition what we get? We get burning sensation on tongue and the mucous membrane of the mouth. So there also Angioitico-1 works nicely. Sometimes patient may complain of having diplopia from traumatism, muscular paralysis and retinal hemorrhage. We get many cases in our clinic, the patient suffering with this retinal hemorrhage. So here Angioitico-1 only, if we give him, that will work better and patient may cure rapidly. In cases of bruise, sore feeling in eyes, soreness, if the patient feel tired, weary after sightseeing or continuous work over the laptop, television, films screen, in that condition, sometimes what we get, patient complain of having tiredness of eyes. In that condition, it may work along with favourably. Sometimes we may get eyes puffy, face also puffy. There too we may apply Angioitico-1. Then what is its effect over the ear? Over the ear, what do we get? Earache. Sometimes continuous noise in the eyes due to rush of blood to the head, shooting pain around the ears, sometimes blood from the ears, dullness of hearing after concussion or any trauma, pain in cartilages of ears, deafness, this Eustachian cataract with high pitched voice, burning in ears, earache with headache, humming and roaring sound, along with aural polypus. In that cases, Angioitico-1 only can give very nice result. But one thing, when there will be mucopurulent discharges of the air, in that condition, cancer ratio 5 must be added with Angioitico-1. And in cases of pain in the cartilage of ear, cancer ratio 3 should be given, because cancer ratio 3 works nicely over the cartilages. Then comes hemorrhage. What type of hemorrhage? Suppose hemorrhage or bleeding in nasal operations, epistaxis, then after bleeding after every fits of coughing, blood with cough, dark bluish blood even be seen, nose that feels sore, ulcerated with the tenacious secretion from posterior nares of throat. In that condition, F1 and P4 should be given along with Angioitico-1. Sometimes what we get? We get watery, excoriating discharges from the nose, usana, ulceration of septum of the nose. In that condition, green electricity must be applied locally, and internally Angioitico-1 should be given. Sometimes we get the patient tends to blow nose all times, as like in hay fevers. In that condition, Angioitico-1 and scrofloxacin must be alternated. In cases of chronic rhinitis, where mucous membrane becomes dry and congested, in that condition petrol 1 and Venrio 1 must be added along with Angioitico-1. But one thing always mind, every time we are giving repeated warning that no two or more medicines should be mixed together, but they must be given separately at different times. Then come to the mouth. Mouth ulceration is mouth, where we get fetid breath, dry and thirsty, bitter taste, then taste like bad eggs, peppery taste, empyema of maxillary sinus, tongue swollen, flabby, sometimes slimy, shows imprint of teeth like scalded tongue. In that condition, Angioitico-1 is the good remedy. In cases of stomatitis, Angioitico-1 must be given along with the green electricity, and this green electricity must be prepared in glycerin, which is also called glycerol, green electricity. Ulceration of tongue and these fissures toward the edges, in that condition we give gargle of green electricity along with Angioitico-1 internally. We get patient sunken, flushed face, neuralgic pain in all directions from upper jaw, redness and burning cheeks, hectic flushed face, fullness and tenderness behind angle of jowl. In that condition, this Angioitico must be alternated with cancerous O4, because it works nicely in pain and obstruction of the angles of the jaw, where patient cannot open mouth freely. Then Angioitico-1 has good effect over the stomach. What type of symptom we get? We get canine hunger, pain in stomach during eating, then repletion with loathing, oppressive gases passes upward and downward, fetid vomiting, bitter taste. In that condition, here if there be fetid vomiting of blood, in that condition Angioitico-1 must be given or alternated with scrofulosol 11. And in case of pulsation in epigastrium region of the patient, in that condition Angioitico-1 and scrofulosol 1 must be alternated. In atonic dyspepsia, it should be given with scrofulosol 10. And in case of ulceration and cancer of the mouth, cancers of 5 and green electricity must be used according to need along with Angioitico-1. In cases of gastritis, there too it works nicely, but must be given with cancerous 15. In burning, vomiting, nausea with salivation, in that condition not only Angioitico-1, but if it be given with vermifugo 1 then this type of symptom may be vanished. We get sinking and spitting of bile. In that condition, Scrofloxacin must be given with Angioitico-1. In case of this your gastroduodenal cataract, Scrofloxacin and cancerous of 15 to be given with Angioitico-1. In distended abdomen, offensive flatus, this Scrofloxacin should be given along with Angioitico-1. Sometime we get liver torpid tenderness, having history of jaundice, pain over the right hypogastric region, even in region of gallbladders, that may be due to gallstone. So if we get such type of complaint of gallstone, so it must be alternated with Scrofloxacin. And for this your torpid liver, jaundice and tenderness of liver, Scrofloxacin is to be given with Angioitico-1. We get bilious diarrhea, gushing stool. Here too, Angioitico is to be given, but along with Scrofloxacin. We get good result of cancer of rectum. Angioitico-1 along with cancerous of 15. Some patient may have staining of tenesmus in diarrhea with offensive brown bloody putrid and involuntary stool that looks like brownish. Must lie down after every stool. Dysentery, stool with muscular pain अथवा cramp, chronic digestive disorder, hemorrhage of bowel, even in typhoid. Here too we use Angioitico-1 along with cancerous of 10. In case of dysenteric stool with muscular pain, Angioitico-1 is to be given with cancerous of 13. Sometime patient may complain of prolapse of rectum, anal fissures. Here Angioitico-1 can be given with a lotion of green electricity for the rectum. If there be constipation, then S-last must be given at night, 10 to 15 globules with lukewarm water, and during stool smarting pain in rectum, instead of Angioitico-1, here Angioitico-2 is to be given. After stool, long lasting pain, it is applicable. So as we know, Angioitico is a vast series of medicines. Angioitico-1 is a great remedy, and in a single episode it is not possible to cover the therapeutic effect, to describe the therapeutic effect of all the organ and system. So in next episode we will try to cover the entire therapeutic effect of Angioitico-1 over the remaining organ and system of the body. So till then, stay well and healthy. Thank you very much.